it is not your fault. You just haven't necessarily found the roadmap or been given the roadmap to understanding what's going on in your body. My name is Melissa Seifried, and I'm a registered physiotherapist. My background is in orthopedic physiotherapy, vestibular physiotherapy, and post-concussion rehab. I had the opportunity early on in COVID to work with one of the founders of Cornerstone Physiotherapy to create a program specifically around helping people manage and rehabilitate who have been diagnosed with confirmed or suspected long COVID. We have had the opportunity to grow our clinical team, introduce new disciplines to the program, and help people not necessarily just with long COVID, but other post-viral or post-infection conditions. There's a lot of confusion sometimes. People will develop symptoms not necessarily understanding that there is an infection or a viral onset. Primary care often doesn't necessarily catch this as well. I think the medical system struggles because it is looking for broken parts. Often the driving forces behind persistent symptoms with some of these post-infection conditions are not a problem. They're a problem with the software, a problem with the system that is kind of controlling everything else. Recovery is a loaded term. What we're really after with rehabilitation of complex and chronic illness is optimization of function, improvements in quality of life, better symptom control, and teaching people how to live with and manage the conditions effectively so that they can re-engage with their lives and meet their functional goals. Using wearable technology is a way for us to look kind of underneath the surface. Things like heart rate variability or resting heart rate can be clues to how the person's doing. We can look at trends that can tell us if, a person is heading towards a symptom exacerbation or post-exertional malaise, what we would typically call a crash. We can teach people their individual patterns and what to look for, and it gives them some control and some more insight and allows them to better participate in their lives. Physiotherapy helps patients with the movement side of things, and occupational therapists can help patients with managing cognitive dysfunction or cognitive difficulties and cognitive pacing, as well as creating comprehensive return to work programs, and also helping them to manage the mental health side of these conditions. Within Cornerstone, you can work with a physiotherapist, an OT, and an RD, and we can kind of collaborate. So we're not kind of existing in silos. And if one member of your team is noticing something that should potentially be addressed by another member of the team, we can kind of coordinate the care that way to ensure nobody slips through the cracks. Virtual care allows us to meet patients where they are in the environment that they are most comfortable in. Many of our patients take our appointments virtually from their couch, from bed. They can take breaks more easily. If you think that you might have a post-infection condition, would be to reach out and book an initial assessment with one of our physiotherapists. In that initial appointment, which is 60 minutes long, we'll go through a full clinical history, past medical history, and look at sort of what your day-to-day symptoms look like, what your day-to-day function looks like, not having to wait a year and a half and suffering unnecessarily. I think it's important for patients to advocate for themselves, and we can help support them in that way too.